Have you ever attempted to get out of your favorite chair only to discover that your legs aren't supporting you as well as they once did? To stand, you might need to push off your knees, lean forward, and give yourself a little boost. Or perhaps, you feel as though you're walking through mud when you cross the living room. Your legs can feel heavy at times for no apparent reason. You feel unsteady on your feet. Just in case, you find yourself reaching for furniture. The majority of people now attribute this to just getting older, but that isn't the whole picture. What you're experiencing could be the first indication of something more serious. Something that most people over 60 aren't even aware is taking place in their bodies. It is known as sarcopenia, or age-related muscle loss, and it develops gradually. No discomfort, no edema, and no loud alert. Every month, just a bit less strength. Every day, a little more work. Here's the good news though. This is a two-way street. In fact, you can regain your leg strength. And not in months, but in a few days simply by providing your body with the 3 essential vitamins that support energy, balance, and muscle movement. No gym, no costly therapy, no intricate schedule. It's a straightforward, scientifically supported solution that makes your legs feel lighter, your steps feel more powerful, and your confidence return. Stay with me then. We'll discuss how these 3 vitamins work together to help you wake up in the next few minutes, as well as which one most seniors overlook. Before we continue, please remember to hit the bell, subscribe, and forward this video to a loved one. Someone else's journey might be altered by your story. After 60, the body undergoes a subtle change that most people initially fail to notice. You continue to eat the same foods and may even walk a little each day. However, something has changed. It feels harder to get out of bed. Stair climbing? Halfway through, you might stop to catch your breath. Additionally, your legs don't seem to support you as well when you sit down. This is the appearance of early muscle loss. The biggest and strongest muscles in your body, your legs, are frequently the first to notice. Furthermore, you are not to blame. Even if they feel healthy, people over 60 may lose 1 to 3% of their muscle mass annually, according to science. You might be losing up to 15% of your leg strength in just 5 years, and you might not even be aware of it. So why does this occur? 3 things are against you. First, as you get older, your body absorbs fewer nutrients. Because your stomach produces less acid, important vitamins such as those your muscles require are not properly absorbed. You may not be getting the nutrients your muscles require, even if you eat healthily. Secondly, your blood flow slows down. Your legs receive less blood flow, which results in less energy, less oxygen, and increased fatigue. Your legs may feel heavier at the end of the day, cramp more frequently, or react slowly when you want to move quickly because of this. Third, your level of activity varies. You may not walk as much as you once did. Stairs may seem like a chore. The catch is that without the proper diet, your muscles cannot grow or recover, even if you are an active person. It's similar to attempting to construct a house without bricks. This is where things change though, because your body can produce unexpected outcomes when you give it the 3 vitamins it is lacking. Tired legs begin to feel solid. Wobbly movements become fluid. It's not a miracle. Finally, biology is receiving what it requires. The first, and perhaps most potent, vitamin your legs have been waiting for is what we'll discuss next. It's likely that you're not receiving nearly enough. Let's start with vitamin D3, the most underappreciated but potentially most effective vitamin your muscles require. Vitamin D may be familiar to you. I take it that's the one that comes from sunlight? Yes, but there's more to the story than that. Because vitamin D3, the active form that functions as a master switch for your bones, muscles, and nerves, is what your body actually needs, especially after the age of 60. If your body were a machine, D3 would be the switch that activates the engine. This is the issue. Your body's ability to produce this vital nutrient declines significantly after the age of 60. When exposed to sunlight, your skin produces less vitamin D. It is converted more slowly by your kidneys and liver. Additionally, the natural supply dries up because most people over 60 spend more time indoors. The outcome? Your body starts to silently and unexpectedly shut down important systems. Muscles deteriorate, joints become more rigid, your legs feel slow, unsteady, and heavy. Unfortunately, a lot of people accept this as a natural part of aging, even though it's a fixable shortcoming. Let's now discuss symptoms. When you climb stairs, do your legs tremble? Does the mere act of standing still for a few minutes wear you out? Do you have leg cramps when you wake up in the middle of the night? All of these are warning signs that your body might be deficient in D3. Something more subtle, like a feeling of unsteadiness when you walk, may also be noticed. Or even changes in mood, difficulty falling asleep, or an unusually high level of irritability. Unbelievably, each of these may indicate a vitamin D3 deficiency in its early stages. The good news is that once you fix it, the change can happen quickly. According to a University of Birmingham study, taking 800 IU of vitamin D3 daily for 5 days increased leg strength by 19% in people over 65. Seniors who took D3 and engaged in mild exercise restored their strength and balance in a matter of weeks, according to another Chinese study. Additionally, Harvard research revealed that people with low D3 had a 40% higher risk of falling, but recovered stability when their levels rose. How does it operate then? Yes, vitamin D3 aids in the absorption of calcium for bones, but more significantly, it stimulates muscle fibers, enhances nerve signaling, and even lowers the silent inflammation that gradually weakens your legs. Let's discuss age. The majority of experts advise healthy adults over 60 to consume 800-1000 IU daily. Your doctor may recommend up to 2000 IU per day if you have experienced a fall or if you feel particularly weak or unsteady. However, before going higher, always consult your provider. When is the best time to take it? Always with a meal that contains healthy fat, such as salmon, eggs, or olive oil, in the morning or early afternoon. This facilitates your body's absorption of D3 because it is fat-soluble. Steer clear of taking it right before bed because some people may have trouble sleeping. Is food enough for you? Sadly, it's difficult. You only get 40 IU from one egg. Milk in a glass? Roughly 100 IU. To meet the minimum, you would need to consume multiple servings of dairy or fatty fish each day. The majority of seniors require supplements because their bodies no longer process D3 as well as they once did, not because they are ill. One last thing. Although taking too much D3, more than 4000 IU per day for extended periods of time, can cause high calcium levels, kidney stones, or nausea, it is generally safe. Therefore, take the recommended dosage and monitor your levels frequently, particularly if you have liver or kidney disease. To put it briefly, vitamin D3 is not only good for bones, your muscular system is awakened by it. Additionally, when taken properly, it can restore balance, strength, and the pure joy of fearless walking. Vitamin 12 is the wire that connects your muscle engine to the driver, if vitamin D3 is the switch that activates it. It's what connects your brain to your muscles, enabling you to move with assurance, maintain your equilibrium, and maintain bodily control. Nevertheless, one of the most prevalent deficiencies in older adults is B12. I'm sure you've heard that B12 helps with energy and memory. That's accurate, but it's just the beginning. The majority of people are unaware of how important vitamin B12 is for the health of nerves, particularly those that run down your spine and into your legs. Your nerves are no longer able to communicate clearly when your B12 levels fall. At that point, your legs begin to feel odd, as if they aren't really listening to your brain. How does that feel then? Your feet may initially feel numb or tingly. After only a short distance of walking, you might feel as though you need to sit down or notice weakness in your legs. Some people have the sensation that their legs are dozing off. Others claim that even on level ground they feel unbalanced. Additionally, the symptoms can occasionally be completely non-physical. You may experience mental haze. You overlook minor details. Even after sleeping, you feel exhausted when you wake up. Some even experience mild anxiety or sadness, which they attribute to just getting older. In actuality, though, these are typical symptoms of a B12 deficiency. Why does it happen so frequently after age 60? There are two main causes. First, as you age, your stomach produces less acid, which is necessary for the absorption of vitamin B12. Second, the absorption of 12 is hampered by a number of common medications, such as antacids and diabetes medications like metformin. Additionally, you're already consuming less of it if you eat a plant-based or low-meat diet. Your body may no longer be absorbing enough, even if you eat healthily. And this is supported by research. According to an Oxford University study, seniors with low B12 levels were twice as likely to fall, walked more slowly, and had poorer balance. The results of another clinical trial that administered 0 micrograms of 12 daily to older adults for 8 weeks were unmistakable. Increased strength, more stable walking, and less numbness in the legs and feet. So, how does B12 function exactly? It shields the myelin sheath, the insulating covering that surrounds your nerves and facilitates the rapid transmission of electrical signals. Additionally, B12 aids in the production of red blood cells, which transport oxygen to your muscles. Because their body's communication system is short-circuiting, people with low B12 frequently experience fatigue, shakiness, or mental fog. How should I take it? In the form of methylcobalamin, the safe and effective daily dosage for adults over 60 is typically 501,000 micrograms. Your body can use this active version right away without converting it. For people who have problems swallowing pills, it is available as a chewable, lozenge, or spray that is taken under the tongue. Never take it with coffee or tea, as these can hinder absorption. Instead, take it in the morning or at lunch. Even though foods like meat, fish, eggs, and dairy can provide B12, you would need to consume a lot of them daily to meet your requirements. A supplement is the better option for the majority of senior citizens. Indeed, it is extremely safe. Any excess is easily flushed out because B12 is soluble in water. However, consult your physician first if you have kidney issues or take blood thinners. The bottom line? Your body and brain start communicating clearly once your B12 levels are back to normal. You feel more connected to your legs. You feel more in control, sharper, and steadier. And it's a priceless feeling to be in control of your own movement again. You know by now how vitamin B12 connects your brain and nerves, and how vitamin D3 activates your muscles. However, the system struggles without the last piece of this puzzle. That component is thiamine, or vitamin bone. Consider it the energy that propels all of your actions. Bone is the fuel if your brain is the driver, and your muscles are the vehicle. It ensures that your body can convert food into fuel, particularly the kind your muscles require to remain strong, stable, and responsive, in addition to providing you with energy. The problem is that many people develop thiamine deficiencies after the age of 60 without realizing it. Why? Because you are caught off guard by the symptoms. Even after completing simple tasks, you may constantly feel as though your legs are exhausted. Or perhaps your lower body feels oddly heavy, as if walking requires more effort than it should. Some say they drag themselves across the room. Others report having frequent cramps in their muscles, particularly in their feet or calves. Additionally, some people report experiencing dizziness or even a decrease in motivation and appetite after waking up too early. These are not merely age-related peculiarities. They are indicators that your muscles are depleting. What, then, results in a bone deficiency? A couple of things. First, absorption decreases with age, particularly if you are taking antibiotics, diabetes medications like metformin, or diuretics, which are frequently prescribed for heart or blood pressure problems. In fact, these can help you eliminate thiamine from your body. Second, even moderate alcohol consumption can affect bone levels. Third, contemporary diets are frequently inadequate. Thiamine is not found in processed foods, and many elderly people consume fewer whole grains, beans, or seeds, which are among the best natural sources. According to a Tokyo University study from 2021, low thiamine levels were present in over 30% of older adults. These people struggled with everyday tasks, moved more slowly, and experienced greater leg fatigue. However, following just 1 week of bone supplementation, 82% of participants reported having more stamina, 68% reported having less leg pain, and many reported finding it easier to walk or climb stairs. What makes it so effective? Because the Krebs cycle, your body's primary energy-producing mechanism, is powered by bone. Your muscles cannot produce enough ATP, the actual energy source that powers your body, without it. Because of this, when your bone levels are low, everything feels slower, heavier, and more difficult. What dosage is appropriate? Although 1.1 mg for women and 1.2 mg for men is the recommended daily minimum, many older adults, particularly those who exhibit symptoms, find that 50 to 100 mg is beneficial. Don't worry, your body naturally eliminates unnecessary substances because bone is water-soluble. When is the best time to take it? With breakfast in the morning, ideally accompanied by some healthy fat or protein. Avoid consuming it with alcohol, coffee, or black tea, as these substances can inhibit absorption. Though it may not receive as much attention as vitamins D3 or B12, thiamine may be the key component that restores your leg's strength, your spring in your step, and your desire to move freely. After learning how each of these three vitamins D3, B12, and bone helps your muscles in a different way, the next thing to consider is how to combine them for optimal effects. Thankfully, the solution is straightforward. Giving your body what it needs at the right time is all about timing and pairing. Take vitamin D3 first thing in the morning. It should always be taken with a meal that contains healthy fat because it is fat-soluble, such as a small piece of salmon, a boiled egg, yogurt, or an avocado slice. Immediately after breakfast, take your D3 capsule. This reduces the possibility of sleep disruption later in the day and aids in your body's better absorption. You can also take vitamin bone, thiamine, with that same breakfast. It maintains energy levels all day long, and the morning is the ideal time to supply your muscles with this fuel. It goes well with whole grains or protein, even something as basic as toast and peanut butter. Take your vitamin 12 around noon or in the early afternoon. Without disrupting your sleep at night, this keeps your mind and nerves sharp throughout the afternoon. For optimal absorption, pick a spray, lozenge, or sublingual tablet. Just keep in mind that taking it with tea or coffee can hinder its absorption. That's it, no costly routines or intricate regimens. Your body begins to react when you stick to this basic routine. Morning fuel, midday boost. The muscles awaken. Legs feel more stable. It feels lighter to walk. Vitamins may appear straightforward, but like any effective tool, they are most effective when taken sensibly and safely, particularly as we age. First and foremost, avoid raising the dosage by yourself. If a little is good, it's easy to assume that more must be better. However, that isn't always the case. Vitamin D3, for instance, can cause excessive calcium accumulation, kidney stones, nausea, or confusion if taken in excessive amounts over time, more than 4,000 IU per day. It's not about the largest dose, but about the correct one. Second, it's crucial to consult your doctor before beginning any new supplement regimen if you have liver or kidney problems. These organs aid in the digestion and excretion of surplus vitamins. Even typical dosages can accumulate and result in adverse effects when they're not functioning properly. If you have been diagnosed with fatty liver or chronic kidney disease, you should pay special attention to your D3 levels. Third, keep an eye out for minor adverse effects. Although uncommon, prolonged use of high doses of B6, which are frequently included in multivitamins, can result in tingling or numbness. Excessive D3 can cause low appetite or cramping in the muscles. Don't disregard any new symptoms you experience soon after beginning a vitamin regimen. They could be your body's subliminal warning that something is amiss. Finally, checking your blood levels every 6 to 12 months is a good habit, especially for D3 and B12. In this manner, you'll be able to determine whether your supplements are working or if you need to make some adjustments. It's not old age if your legs have been feeling weak, heavy, or unsteady lately, and it's most definitely not your imagination. More significantly, it is temporary. We've seen how vitamin D3 fortifies your bones and muscles, how vitamin 12 reestablishes your nerves and balances your body, and how vitamin bone provides your muscles with the energy they need. They make a potent trio when combined. They are easy, organic, and surprisingly successful. The secret, though, is that it only works if you take that initial tiny step. Adding a morning supplement could be the solution. Asking your doctor to check your levels could be the solution. Do whatever it is, for freedom is motion, and you are worthy of moving with assurance, fearlessly, and without hesitation. Please leave a comment if you have already tried any of these vitamins, or if you have noticed changes in your strength, energy, or balance. Perhaps your story will inspire others to begin theirs. Remember to hit the bell, like, and subscribe so you don't miss any tips that could transform your life or the life of someone you care about. Remain resilient, remain calm, and keep moving forward, one assured step at a time.